Hello. A variety of spacer devices are available to help you use a metered dose inhaler. This video will show you how to use your metered dose inhaler with either a Space Chamber Plus spacer or a compact Space Chamber Plus spacer. You may have a standard or anti-static version of your compact Space Chamber Plus. A spacer is an attachment which makes it easier for you to use your metered dose inhaler, especially if you find it difficult to coordinate pressing the inhaler and breathing at the same time. It also helps to get more medicine into your lungs. If you use your inhaler and spacer correctly, you should have better control of your breathing problem. But if used incorrectly, you may have poor control of your condition, with the risk of side effects, such as a sore throat or mouth infection. We're going to show you two ways of using your metered dose inhaler with the compact Space Chamber Plus. If possible, sit upright or stand up when using your metered dose inhaler and spacer. Remove the cap from your inhaler. Hold the inhaler upright and shake it firmly 4 or 5 times. Insert it into the spacer. When you're ready, breathe out gently as far as you comfortably can. Place the mouthpiece of the spacer into your mouth and between your teeth, but don't bite down on it. Close your lips around the mouthpiece to form a tight seal. Press the top of the inhaler down and take one slow, deep breath in whilst keeping your lips sealed around the mouthpiece. You should be able to see the blue valve move as you breathe in. Hold your breath and take the spacer from your mouth, but continue holding your breath for 10 seconds or for as long as is comfortable. Now breathe out slowly. Here's an alternative method that you can use, particularly if you find it hard to hold your breath. After putting the mouthpiece of the spacer into your mouth, press the top of the inhaler down and take 5 normal breaths in and out through your mouth whilst keeping your lips sealed around the mouthpiece. You should be able to see the blue valve move as you breathe. Watching the valve move can be used to count breaths for children. Whichever method you use, you need to breathe soon after pressing the inhaler, otherwise the medication will fall to the bottom of the spacer instead of going into your lungs. If your doctor has told you to take 2 puffs, wait for 30 to 60 seconds and then repeat the whole process again using your preferred method. Remember to shake the inhaler between doses. Once finished, replace the cap on the inhaler to keep dust out. If your metered dose inhaler contains a steroid, usually known as a preventer, brush your teeth or gargle with water after every use to prevent mouth infections. It's important that you look after your spacer, and here are some tips. Wash your spacer before its first use and then once a month or sooner if it's visibly dirty. Remove the base by placing your thumb in the hole and then pulling and twisting at the same time. Do not dismantle the mouthpiece. Wash the parts in warm water with washing up liquid. If you have a standard version of the compact space chamber, then do not rinse the spacer and do not rub it dry. If you have an anti-static version, then rinse all parts clean in water. Let the parts air dry naturally at room temperature. Washing and drying the spacer this way helps to stop static building up, which can stop your spacer working as well as it should. Firmly replace the base once all of the parts are completely dry. Wipe the mouthpiece clean of detergent before you use it again. Your spacer should be replaced at least every 12 months, but some may need to be replaced sooner. If you're unsure about how to use your metered dose inhaler and spacer, speak to your GP, practice nurse or pharmacist for assistance.